Today, I want to have a frank conversation with you, one without any filters or beating around the bush. If you are a man over the age of 50 or 60, you might have never felt entirely comfortable talking about a subject that, in reality, should be treated with complete naturalness: masturbation. I know, just hearing that word makes many men of a certain generation feel uncomfortable. Some think that's something for teenagers. Others believe it's simply not healthy after a certain age. And there are still those who hide this habit even from their doctors. But the truth is that science has been showing that the frequency of ejaculation can indeed have significant impacts on prostate health. These impacts are positive in many cases, but they also come with some necessary precautions that we need to discuss seriously. So, the big question I want to answer in this content is direct. Does daily masturbation after 50 or 60 do good or harm to the prostate? And I'll tell you right now, the answer isn't as simple as a yes or no. There are nuances, individual factors, and above all, scientific evidence that we need to analyze together. Before we dive into the topic of masturbation itself, it is essential to understand the role of the prostate in a man's life. This small gland, roughly the size of a walnut, sits right below the bladder and wraps around the urethra like a ring. Its main function is to produce part of the seminal fluid, which is responsible for nourishing and protecting sperm during ejaculation. Until then, everything is simple. But what many men don't realize is that as the years go by, the prostate undergoes natural changes. And some of these changes can generate discomfort or even serious health risks. Starting around age 50, hormonal production begins to decrease gradually, especially testosterone. This hormonal shift is directly linked to the benign growth of the prostate, known as benign prostatic hyperplasia, or BPH. This isn't cancer, but it causes symptoms that significantly impact quality of life. Among them are difficulty urinating, a weak or intermittent urinary stream, the sensation that the bladder never fully empties, and waking up several times at night to go to the bathroom. Statistics show that by age 60, about 60% of men already have some degree of these symptoms, and this number can reach 70% or more after age 70. And where does masturbation fit into this story? This is exactly where our topic begins to gain weight. Many men report that when they maintain an active sex life, whether through relationships with a partner or through masturbation, urinary symptoms seem to improve. Others notice that regular practice helps maintain desire, mood, and even a more balanced sleep cycle. But does this have a scientific basis? Or is it just a personal impression? Several studies have investigated this relationship, specifically asking, does ejaculating frequently protect or harm the prostate? Some research, including systematic reviews and meta-analyses, which are studies of the highest scientific quality, suggest that ejaculating more times might reduce the risk of low-grade prostate cancer. One of these analyses revealed that men who ejaculated 21 times or more per month had up to a 20% lower risk of developing this type of tumor when compared to men who ejaculated only 4 to 7 times in the same period. On the other hand, we also know that exaggerated masturbation, especially when associated with compulsive pornography use, can bring negative consequences for sexual and psychological health. Therefore, what we need to understand is, what is the healthy amount after 50? What is considered excess? And how can this habit become an ally to your health rather than a problem? Now that we understand the context, let's talk about the proven benefits. One of the most interesting effects is what we call the prostate stagnation hypothesis, or simply, the idea of a local cleanout. When a man ejaculates regularly, there is a renewal of the prostatic fluid. Think of it as an internal house cleaning. This process helps eliminate old secretions, dead cells, and even potentially carcinogenic substances that can accumulate in the gland. The logic is simple. The more you renew this fluid, the lower the chance that toxins and inflammatory agents will remain stagnant in the prostate. This effect was highlighted in a famous study from Harvard University, which followed more than 30,000 men over 2 decades. The results showed that those who maintained a high frequency of ejaculation had a significantly lower risk of developing prostate cancer compared to the less active group. In other words, maintaining a healthy routine of sexual activity can actually contribute to protecting the prostate against low-grade tumors. Another major benefit is related to blood circulation. Masturbation, like sexual activity in general, increases blood flow to the genital and pelvic region. This increase in circulation brings more oxygen and nutrients to the prostate tissues. It helps maintain the elasticity of local blood vessels and contributes to better functioning of the bladder and pelvic floor. This means that the act doesn't just stimulate the prostate, it helps maintain the health of the muscles and nerves involved in urinary and sexual function. It essentially follows the biological rule of use it or lose it. But I know that for many men, using it feels impossible because the machinery just isn't cooperating like it used to. If you're dealing with limpness or relying on dangerous pills just to get by, you need to see this. There is a powerful, 100% natural, 7-second morning ritual involving a unique purple tonic that targets the true root cause of ED. It's helping thousands of men restore rock-hard erections without side effects. Take your phone out and point your camera at the QR code on the screen right now to watch a short presentation on how this simple home remedy works. I've also pinned a link in the comments below. Check it out. Then there is the mental and emotional aspect. Masturbation promotes the release of endorphins and oxytocin, hormones linked to pleasure, relaxation, and a sense of well-being. For men over 50, who often face a higher risk of anxiety, chronic stress, or even depression, this natural chemical release can be extremely beneficial. Furthermore, we know that stress is a factor that worsens urinary symptoms and is linked to higher inflammation in the body. So, reducing stress through regular sexual activity can, indirectly, improve prostate health as well. We also have to talk about libido. Many men report that desire diminishes with age. This is linked not only to the natural drop in testosterone, but also to a lack of stimuli. Masturbation can act as an important physiological stimulus to keep the libido active. When you practice, the brain continues to recognize and respond to sexual stimuli, preserving the connection between mind, body, and pleasure. It's almost like a workout to keep your sexuality alive, even during phases of life where the frequency of relations with a partner might decrease. And perhaps surprisingly, a balanced practice helps prevent sexual dysfunction. It might seem contradictory, but frequent erections are fundamental for penile health. When the organ is regularly irrigated with blood, there is greater oxygenation of the tissues, preventing fibrosis and atrophy. Men who go long periods without sexual activity have a higher risk of developing erectile difficulties in the future. Therefore, regular masturbation can function as a maintenance exercise for erectile function, especially for those without a fixed partner. Lastly, but very importantly, there is the impact on sleep. After orgasm, the body releases substances that favor relaxation and drowsiness, such as prolactin. For older men who often suffer from poor sleep quality, whether due to stress or trips to the bathroom caused by an enlarged prostate, this effect can be a great ally for quality of life. However, as with everything in life, balance is key. We need to look at the flip side. While regular activity is beneficial, excessive, daily, and repetitive masturbation can generate the opposite effect. When the gland is overstimulated, especially in short periods of time, a mild inflammation called congestive prostatitis can occur. The symptoms deserve attention: pain or burning when urinating, a feeling of heaviness in the pelvic region, painful ejaculation, or a frequent need to urinate that isn't related to a full bladder. If these signs appear, it is a clear warning from your body that you are overdoing it. There is also a modern trap we must discuss: the risk of pornography dependence. One of the main problems today isn't masturbation itself, but its exaggerated association with compulsive pornography consumption. Many men report that over the years, they have come to depend on this super stimulus to get aroused, losing interest in real relationships. This condition alters the brain's reward circuits, releasing unnaturally high doses of dopamine. This generates a kind of cycle where a man needs increasingly stronger stimuli to feel the same pleasure. Furthermore, we cannot ignore physical fatigue. Masturbation involves energy expenditure. Men over 50 or 60 naturally do not have the same recovery capacity as they did in their youth. Many report a drop in energy after the act, difficulty concentrating, or excessive sleepiness during the day. If you find yourself in a pattern where you are practicing multiple times a day and feeling drained, or feeling pain in the pelvic region, this is a clear sign to step back. So, what is the verdict? If I had to summarize all this research into a simple piece of advice, I would say this: regular masturbation, done in a balanced and conscious way, is good for the prostate and for a man's overall health. The problem lies only when it becomes compulsive, associated with an excess of pornography, or used as a substitute for all other forms of intimacy. Let's also break a few final myths. Masturbation does not cause prostate cancer. On the contrary, it may help prevent it. It does not permanently reduce your testosterone levels. Variations are temporary. It does not shrink the penis. That is a myth without any scientific foundation. And it does not replace a real sex life, although it brings benefits. It shouldn't be viewed as a shameful act, but rather as a tool for health maintenance. There is no perfect number or mandatory frequency, but rather an interval that respects your body, your energy levels, and your well-being. Listen to your body. If it feels like a healthy release that improves your mood and sleep, you are likely on the right track. If it feels like a compulsion that leaves you tired or in pain, it's time to find a better balance. Take care of your health, keep your mind open, and remember that maintaining your sexuality is a vital part of healthy aging.